Hello, hello. My name is Jess, and this is Patient POV. And today we're hearing from Maria, and I'm super excited for you to listen to her. She is a student, and she also has multiple chronic illnesses. And so she's working on her to become a dietitian. And so she has a really good insight in terms of being a patient as well as learning to train as a provider. And so it gives a very nice pairing that you'll get to hear from her today. And so, yeah, I'm super excited for you to hear from her. So I'm just going to leave it at that and let you jump in just a minute. I'll make this nice and short and sweet, but I just wanted to remind you to subscribe and to leave a comment if you would like. I also encourage you to head over to patientpov.ca, and there's more information about the podcast episodes. There is resources, product recommendations, discount codes, and there's the blog as well as some freebies that you can find along there if you sign up to the emailing list. And yeah, so there's really great stuff over there. So head over to patientpov.ca, subscribe, and don't forget to answer the question that is left at the end of a Spotify podcast. And if you are watching on YouTube, feel free to look at the bottom of the comment, the description, and there's a question there. And I would love to hear from you guys. So yeah, thank you guys all so much for your support as always. And I hope you have a great week ahead. Hello, hello. How are you today?
Good. How are you?
Good, thank you. Do you want to just jump right in and give us an introduction on who you are and kind of your health journey background?
Oh gosh, yeah. So I'm Maria Herzlich. I live in Cincinnati, Ohio, which I'm kind of newer down here. I'm from Cleveland. So I still have a lot of my doctors up there, but it probably started maybe when I was like 4 years old. I was diagnosed with neurogenic bladder, and then I was born with hip dysplasia and like a leg deformity. Um, And things were probably fine until I was like 15. I used to be an all-star cheerleader and gymnast, which was actually really interesting because I didn't know that I had these deformities. So I feel like I had to work a lot harder than everyone else. But I feel like it definitely gave me a good work ethic because like I didn't even know that anything was wrong. I was just like, well, I got to do things a different way that
Mm.
worked for me. Um, and then when I was 15, I shattered my femur on my trampoline, and they couldn't figure out what was wrong for the longest time. I had about 10 orthopedic surgeries, and then I was diagnosed with classical EDS. And things just started spiraling from there, I guess.
Yeah. And so, can you repeat the first conditions that you mentioned that you're diagnosed with?
Yeah, so neurogenic bladder, I was diagnosed when I was 4 years old, and hip dysplasia.
Mm.
I was born with that, as well as it's called miserable malalignment syndrome of my legs. My tibias turn outward, my femurs turn inward.
Oh, interesting. Okay. And could you give it like as an educational aspect of it? Could you just explain? You did just explain a little bit of what they are, but what each of those conditions are and kind of how they impact your life?
Yeah, so for me, like hip dysplasia, if you think about like a ball, like your socket of your joint that's supposed to be like covering your hip bone, mine's like this.
Mm.
So it would like slide in and out of place. So they had to break my pelvis and like re-screw it back in. But I've torn that same labrum like 4 or 5 times. I just kept having corrective surgeries on it. And then I've just decided, well, I'm going to wait for a total hip replacement because I don't think it's like worth it to keep going through these same surgeries. And then I had for my legs, it just looked like I was very knock-kneed my whole life, which made it difficult to do cheer because my knees would hit each other. I couldn't get enough power, so they broke my femurs and my tibias and kind of like realigned them.
Oh, interesting. Yeah. And then the first one was the one that you were diagnosed when you were 4. Could you tell me a
Yeah,
little bit about that?
yeah, neurogenic bladder, which I have gastroparesis too, which is it's very similar. where the muscles stop working in your bladder and it causes like a lot of retention and stuff, which just recently at Cleveland Clinic, I got a bladder stimulator put in. And as someone that's had it my whole life, I got like 75% symptom relief, which was amazing.
Oh, wow. Yeah, that is amazing. That's really cool, the technology, how you've seen it evolve as you age sort of thing. That's really
Yeah.
cool. And so, to just take a step back as well, one question that I try to ask every guest does not have to be related to chronic illnesses, but is there any current like shows or movies or books that you're really into right now? Just as an aside of maybe somebody else can look at this as well.
Yeah, so my interest in like viewing videos, I would say is very niche because I'm kind of an educational person as like my major's in dietetics, but I actually find maybe it's because my boyfriend is a criminal justice degree, but I find that going on YouTube and I like watching trials and trying to understand like the law. Like I've listened to a lot of lawyers and I found that very extremely interesting because there was a lot of stuff I never knew. So just to kind of continue to gather knowledge, I guess, is stuff that I watch.
Yeah, no, that's really cool. That's awesome. So then jumping back into about you, as your day-to-day symptoms are, what would you say some of the most challenges, what are some of the most challenges things that you face? And do you have any coping strategies you use for them?
Yeah, I definitely have coping strategies. Right now, the diagnoses that cause me the most symptoms I struggle with the most is narcolepsy,
Mm.
as well as like motility of my GI tract. And we know what it's related to. Kind of, they're trying to figure out if an autoimmune disease right now that would cause it to get worse. But besides that and, like, dysautonomia, probably, like, my biggest impacts in my bipolar disorder. Um, but we do, like there's, like, a lot of treatments that I've tried for a lot of, like, different things, but I would say that I'm the biggest out of everything, I'm probably the biggest advocate for narcolepsy, but
Mm.
just I think people forget how, like, without medication, how much excessive daytime sleepiness really impacts people because sometimes I can't even get off the couch. And that's sometimes really hard to cope with because it makes you depressed when you're lagging down like that. Or just like I've dealt with a lot of like tooth decay from gastroparesis, which has been hard to go get a ton of dental work. And it's something that makes me really self conscious because I'm missing part of my front tooth right now. And then for like the POTS, it's just flared up, which has caused more symptoms. But I'd say like my boyfriends and my friends support like that have been some of like the best coping skills and having friends that either understand and can get me out of my comfort zone, try to get my mind off things. I've recently taken up knitting blankets when I'm not
Oh,
feeling well. So, and normally I work on stuff like that for friends and stuff.
that's
Arts.
awesome. Yeah, arts and crafts. We love that here as well. I think I just saw a post you posted recently of a blanket that you're working on and it looked
Yeah,
so good.
thank you.
That's
That's for my boyfriend's 26th birthday.
Oh, wow, that's amazing. Yeah, that it looked beautiful for sure.
Thank you.
Um, and so could you just explain a little bit about what narcolepsy is and how that impacts your life as well?
Oh my gosh. Yes, it's so crazy because I started learning about it so much because it was something I realized that I had never had. And I think it started when I was 9. The weird thing about it is because at least the type that I have is autoimmune. So it's hard to connect the symptoms because you'll get one symptom. And since it's degeneration of neurons in your brain, you will like that takes time to have another symptom pop up, so it's hard to connect them. I actually was supposed to have a sleep study. I gave in and I canceled it 3 times, and the only reason I went the last time was because I forgot to cancel it that day. And I was just like, this is stupid because I feel like sleep is the easiest thing to brush off in the world. You work too much, your body sucks. Like there has to be another reason for it because that's the only reason that makes sense. That's how it was for me. It's like
Mhm.
I'm up and going. I have all these health issues. Like my body just must be tired. And when I got the diagnosis, I was honestly thoroughly confused why I had it because I'm like, I'm not falling asleep standing up. I don't sleep like long hours. I get insomnia sometimes. I wake up at night. and I have these like nighttime hallucinations. And the more my doctor explained it to me is with narcolepsy, a lot of people have insomnia and really fragmented sleep. And they only sleep on you sleep the same like average time a normal person would. So that was something that was really interesting to me that I just didn't really know about the disease because of how it's portrayed on TV or experiencing cataplexy for me, which is just muscle weakness to like strong emotions. Well, I thought that was falling asleep, but it's more of like a muscle paralysis. And most people don't get it in their entire body. I get it in my face and arms. So I used to think it was like a dysautonomia thing, like, oh my God, I'm going to pass out, you know?
Right, yeah.
And it was different. So I was definitely thoroughly confused. And when I started researching the statistics of narcolepsy, 75% of people with it are undiagnosed.
Oh,
And I think
wow.
that's a huge number because I think it's easy to push off sleep. There's misconceptions, and I've always advocated for people to get a sleep study if they're having that, just to know, like, have the peace of mind because it's non-invasive. Like, you just go and you sleep somewhere for like a day. And it was only after I was diagnosed, they connected a condition called idiopathic hypersomnia, which is similar to type 2 narcolepsy. It's very similar. And they connected it to dysautonomia with since I've been diagnosed. So I
Mm.
feel like a lot of people that have dysautonomia could have a related sleep condition that just hasn't been explored yet. So I try to like speak up about that. I had a friend experiencing similar symptoms that she ended up being diagnosed with it after I got her connected with a sleep doctor.
Mhm. No, that's awesome, yeah, and I love that you're trying to raise awareness for this narcolepsy as well because, as you said, what is portrayed in the media, if they ever talk about narcolepsy, it's typically like you're standing up and then you just get very sleepy and you fall asleep in the middle of the day, and it's like a complete sleep, but you're saying
Yeah.
that that's not necessarily always the case.
Yeah, it's like there's when they diagnose you, there's like sleep latency, and you have to be under 8 minutes and go into REM sleep because it's wild to go into REM sleep during the day so quickly.
Mhm,
But like my sleep latency is 4 minutes. So when I get tired, I still have like 5 minutes if I want to go get to bed or pull my car over and take a nap. And you normally only need about a 15-minute nap to feel better
mm,
because your brain's trying to cycle through REM and eventually it stops. So you only need these like short little naps throughout the day. It's not like falling asleep all day or anything like that. But my colorectal surgeon, her husband has narcolepsy, and his sleep latency is under like 30 seconds. So someone like that, he falls asleep very quickly.
and so, can you just explain for anybody who's listening what sleep latency is?
Yeah. So sleep latency is like so if I like lay down to take a nap or go to sleep, it's like how long it takes to get to sleep. So
Mm,
anything under 8 minutes normally is indicative of like idiopathic hypersomnia or narcolepsy. The only difference is in narcolepsy you go into REM sleep. The other condition you don't.
interesting, okay. That is very interesting. So then jumping back into you and what
Yes.
you're up to, what would a day in the life like if you have a typical day in the life, what would that look like for you?
Like typical with my chronic illness or is typical outside of that?
Typical about like if you like looked at your entire day start to finish, what would a general day look like, which could include how you're coping with your chronic illness, but it could also include like if you're doing school, how do you manage that? Those sorts of things.
Yeah. So right now I've taken a break from school just because I've had a number of surgeries lined up lately. But I mean, this is like kind of one of my favorite questions related to chronic illness because I feel like it's something that you could give an average person and explain them. I always explain like my day looks different from the moment I wake up to the moment I go to bed from
Mhm.
yours. And like that's some of the best analogies I could give. So I have to wake up, I have a feeding tube, take care of my feeding tube. That's normally the first thing I do. Take my medications. Sometimes then I'll sit down and knit for a while or read a poetry book. Me and my boyfriend, sometimes we'll go out shopping, whatever. And then there are obviously better days where I don't feel like I have to cope, but there are some days where I'm just like, I got to nap all day, like on and off naps. Like I don't feel like I can get much done. And then just like cleaning, like I live on my own. So like cleaning an apartment, it's a 2 bed, 2 bath. It's pretty big.
Mhm,
Just had foot surgery and stuff. So like the way I cope with that is I'll set like a 15-minute timer, try to get stuff done. Then for another 15 minutes, I'll try to rest. So I can keep up on it and also just like keep my brain in the right space, I think, to be able to do all that stuff. I'm a person that tends to overwork myself and I'm not always the best at coping. Obviously, I see regular therapists, which ironically, she has HSD and Addison's disease, I think,
mhm,
and bipolar disorder. So I feel like I've had a therapist that has given me really good coping skills because she can understand from a personal level.
mhm,
And that's really helped me. She's the one who gave me like 15-minute timer
mhm,
tips to like if I have to like run fluids, I'll run fluids. I try not to do that too much, but when I need it, I need it. And I kind of have come to terms with I can't push myself too far when I need to cope or I need to do some sort of like treatment that I need to like sit down and focus on doing that so I can actually be productive some of the
mhm.
day.
Yeah, no, for sure. That's so awesome. Yeah. I like that 15-minute trial thing because I also have a tendency of if I have a task in front of me, I'll just keep trying to work until till I finish it. And
Yeah.
sometimes that results in a flare later on as well, for sure.
Yeah, and another good tip is like when my apartment gets like super messy, she always told me just get a trash bag, walk around all your rooms, throw the trash away first. Or if your
Mhm,
room's messy, because for me, I leave a mess in my wake when I have mania. I don't experience a lot of pain during that time and I just turn into an art god. So then I'm left with all of this mess, and it's a lot when you're dealing with illnesses.
yeah.
And so I kind of just go room to room. I put trash away in a bag and get all the trash out. And sometimes I will put like all the mess almost in like a suitcase, a box, and clear out the room and then slowly put the stuff back together
Oh.
instead of like tripping, not this goes where, what am I doing next? Like if I could, it's almost like moving in again. It's easier to do that.
That's an interesting way. I've never heard of somebody have that technique, but I really like that. That sounds really good for anybody, especially who is struggling with a big mess has accumulated, whether it is from an episode or from just like with chronic illnesses, sometimes
Yeah,
we
because
can't
you
stay on
can't
top of
keep it
it.
all the time.
Yeah, yeah, for sure. And so I know you're mentioning you were taking a break from school, but what are you doing in school right now?
So I used to be a biology major at UK, which I lasted a month there and had to go home and get my first feeding tube,
Mm,
which sucked. So I transferred to the University of Cincinnati with my boyfriend, and I switched my major to nutrition and dietetics because I'd say that's like the second thing that I'm most passionate about because I was on TPN for 2 years.
mm,
Like my gastric emptying scan was like 96% retention after like 4 hours. I have it pretty bad. And so I felt like for me anyway, it was always vulnerable for me because at a time I was 80 pounds. I felt like I was watching myself waste away, like my eyes were sunken in. And I always loved my dietitians. There was so much to do and like watching myself through that situation and like tube feeds and stuff. And I've helped other people with that. And it definitely gave me a passion because I know I never could be a nurse. Like I have enough time in healthcare that I wouldn't want to constantly be there or constantly be with patients all the time. I don't think I have the bedside manner for that either, like the patients. And so I would like to be able to consult outside of a hospital as
mm,
well as just going in for a consult in a room in which I could go back to my office
mm,
and I'm still helping patients or a really like I feel like I wouldn't get burned out because something I didn't know about it. I would say clinical dietetics makes the least money, but you can work for schools like
mm,
WIC, Women and Children's, that helps like food stamps and people getting the proper nutrition that can't afford it, as well as working for like bigger corporations like Kroger managing food placement, types of processing, and for like corporations, you make a lot more money. So there's a lot of ways that I could move in the field if I don't want to stay in one area, which I kind of get impatient with that stuff. So I wanted to pick something I wasn't stuck in one spot.
Right, yeah, no, that totally makes sense, and I also didn't realize that because when I think of a dietitian, I think of, like I had a dietitian, consult with me when I was getting diagnosed with celiac, and so I met with her a few times when we were having, like, the food changes, but so in my head, it's always clinical where the dietitian works, but it's really cool to hear that they work in multiple sectors, so that's really cool, and so how do you think, being a patient yourself of having consulted dietitians, how do you think your experiences will help you work with patients in a more like patient-centered care mindset?
Yeah, I want to very much like come from an aspect of understanding because I've run into dietitians where it's like, oh, this feed formula hasn't worked or this food hasn't worked. Like just keep trying at it. We'll try something similar. And I really want to be able to listen to the patient's needs as well as what I would know to be able to give them a better treatment. And also, when one of my narcolepsy medications, I had to meet with because it is like it would be like a level 1 controlled substance if it wasn't prescribed.
Mm,
So I had to meet with a pharmacist almost every week to go over medications, and the coolest part was she told me she had a feeding tube, and that was when I felt like I was, like, down on myself about going to school because I feel like, "Oh my god, I'm never gonna get this done." So it's kinda like one of those, like, I guess an inspirational moment to me. She was like, "Oh my god, I have one too," and even the pharmacist that I go, he's like, "My brother has one and he's doing this." So it gave me the confidence more that even if I was like working with kids or adults, I want to be able to like show people that like those things like don't hold you back from what you're doing. And if you're feeling bad about it right now, I even tell like Tubi pads, like those cute little like pads they make. Sometimes in the hospitals, they'll ask me about it. And so I always tell the dietitians or even the doctor I had last wrote it down. I said, like, tell this to your pediatric patients. I think it would be a really great way to cope with a feeding tube. And they'll write it down and they'll like continue to follow that for kids getting their first feeding tube. And I feel like that's a good way for children to cope.
yeah, no, that's amazing. I love that very much. And so my next question for you is, do you have any like concrete resources or tools that you use in your day to day to cope with any of your conditions?
Yeah. So obviously, like medication is a big one for mainly my bipolar disorder. Seeing a regular therapist because I'm a person that can kind of spiral and get overwhelmed. Like I know I'm not the best with it. Like right now after my foot surgery, I think there's like a little bone sticking out. I haven't scheduled a doctor's appointment yet cuz like part of me is like I don't want to cope if I need like another surgery right now. So it's like, even for me with the coping, I need to work on it. I mean, I think everybody does to a certain point because everybody's bad at different things to like make those calls and not get so burnt out sometimes. But just being on top of my medications, like seeing my therapist, using the people around me and communicating how I'm feeling, what I need. And I'm not a person that likes to ask for help. But if I need help, people will be there. I have an amazing friend that mainly helps me cope, I think, and she's a great resource as well as like my insurance company. They provide like transportation if I need it after like my foot surgery. I can earn money from going to doctor's appointments, a debit card to pay for my bills. So
Mm,
that's been a good like coping way to take some of the stress off living when you can't work at the moment, but still paying your bills, which was like definitely like a huge stressor sometimes,
mhm.
especially in today's economy. But I definitely have a friend, she has bipolar disorder and some of the same things as me. She lives down here. And if I have to go to the ER urgently, she'll either take me or just show up without me knowing. She's always been there for me. So we always have each other. And I feel like having a good person that understands what you're going through is going to be able to communicate with you better, to like push you when you may have trouble at coping. Like they're there to help get you where you need to be when you're struggling in that time.
Yeah, no, amazing. Yeah, so the support system is a huge thing for you, and I love that very much. And so my next question is, Do you have any experiences in I know you're in America, so do you have any,
Yeah.
experiences with any doctors who you feel like weren't really listening to you or, any of those circumstances happen to
Oh,
you?
oh, for sure. I've had lots of those circumstances. Honestly, Cincinnati has been pretty decent for the most part. Sometimes Cleveland clinics are a hit or a miss, but the one that stands out to me was after I shattered my femur in 2015. I had gotten CRPS in that leg. I was seeing a neurologist at the time, and that's when I started having almost directly after I broke my leg, I was having symptoms of dysautonomia, and I think it was related to the CRPS.
Mm,
And so I asked him, I said, like, "You're a neurologist, like, could I get tested for this? Or I was having GI trouble. Like, could you like run a gas emptying scan?" And that was 2 years before I was diagnosed. And he said, "No, I had IBS and fibromyalgia just from a checklist." I was very
mm,
frustrated years later because I feel like maybe if some of it was caught early enough, it wouldn't have been as bad as it was. So I
mm,
definitely get really frustrated with him specifically. Or like I went to the ER, one of the leads on my bladder stimulator migrated into my spinal cord and was causing almost like full body CRPS. I was throwing up. I had headaches. My whole body was on fire and I couldn't figure out what it was. Like I wouldn't have guessed it was related to my stimulator and I got an x-ray of it. Hospital goes, "Oh, it's fine." And I sent it to Cleveland Clinic and they're like, "Oh, it's in like your spinal cord. It's not supposed to be there." And I'm like,
Oh, goodness, yeah. And so just for anybody who's listening, CRPS is, correct me if I'm wrong, complex regional pain syndrome, is that correct?
yeah, luckily I did do a pain program and I've been in remission for it for years. So,
Oh, good. Okay, yeah, because pain is never fun. Somebody with chronic pain, I can
yeah.
attest, like, I could not imagine, the type of pain you must have been in, and that's not fun whatsoever. Um, do you have any advice for anybody if they were, like, going through a similar situation where they're feeling like they're being dismissed or they're trying to advocate for something and asking for tests and they're just getting dismissed? Like, how do you cope with that?
I think it's always okay to ask for a second opinion or even a third opinion because
Mm,
I've done that. I've been bounced from doctor to doctor, especially when they're like, "I can't help you. I can't do this or that," which I respect when they tell you up front that they can't help you. I understand. But when they're dismissive, I feel like getting that second opinion, and even for me, my therapist is also qualified to be a case manager. So I feel like I've
mm,
had difficult appointments, and a case manager is a great resource. She's come with me to a few appointments and was
mm,
able to advocate for me, and even like she's thought of things doctors haven't thought of. And I feel like sometimes they look down on patients sometimes, and they almost respect more a case manager, or if you're able to have someone at that appointment where you don't feel like you have a voice as much, just like that secondary, like, yeah, this is happening, like, please believe me type of thing. Like, I have other people confirming it, and I don't think I think advocacy is a big thing and just getting those opinions. And if that doesn't happen, a good support system and just the mindset, especially when things are getting worse, not to give up because I don't think things are always going to be like that forever.
mm.
Sometimes things take a lot of time, which is very unfortunate. Um, but those are things that I've done in my life to try to at least get something. And the case manager for me is probably the best resource I ended up finding. Honestly, I didn't know it was a thing.
Yeah, no, I didn't I know that there's some people who are, like, patient advocates and can go into appointments with you, but I think that's so cool that your therapist, who you speak to on a regular basis and knows you very well, was able to be there for you as well. So I think that's really, really cool that you found that.
Yeah.
Um, and my last question for you today is on a whole, do you have any words of encouragement or advice for anybody who's either starting their health journey, they're in a flare, they're dealing with difficult situations? Do you have any advice or words of encouragement for them?
Yeah, and especially, for me, I don't have a lot of family support. I was adopted from within my family, and I had grew up with a very abusive, dismissive family. I'd have to drive myself to appointments with casts on my legs in the snowstorm because nobody would take me. And it just feels like it's easy to give up or it's in your head. But if you find those people and surround yourself with those people that you can call your family that are going to be there for you and help you. And like in my experience, I get burnout. And I think it's okay to get burnout and put things on the back burner to a certain point because you just can't keep going and going and going all the time. It's very unrealistic. You will get tired and like things will get harder, but it doesn't totally like end your life. Like you will continue to have a thriving life eventually. It's getting through those rough patches and roller coasters. What my physical therapist used to tell me was it's a season in your life. There's fall, winter, spring, and summer. Eventually, seasons will change. And whether it's better or worse, and I know, especially when you're beginning your health journey, people will tell you it's chronic and you understand, okay, it's lifelong, but the further you get, you almost have this thought that it's like, I didn't think it was going to be this long. Like it was that
Mm,
subconsciously you understand, but it's just like, okay, it gets harder, like this long. Like, when does it end? When does it end? And I think having other people support you and be like, we can help manage this with you. You're not alone. And yes, this is going to go on forever, but who's to say 5 years down the road, there's not a treatment or something that's going to end up making life a little easier. So that's a reason that I don't give up. Like I found a bladder stimulator. I had it
right.
that for 20 years and I found relief. So it's just crazy if you can just keep holding on through some of what feels like, "Oh my god, it should have ended by now," even though I know it's my whole life, like,
Mhm.
there's gonna be something out there. Like, you can find doctors that do crazy insane treatments. If you sometimes you just have to get the right referral, right information, and it's hard, but to do as much research as you can too on your own to kind of get a grasp and understand what your next steps are gonna be.
Yeah, amazing. Wonderful. Well, thank you so much for joining me today. I do appreciate you taking the time.
Yeah, of course, thank you so much for having me on, it was so fun.